Hello everyone. Let's see some information about periodontal abscess and a case about drainage of periodontal abscess. What is periodontal abscess? It's a localized first field infection within the supporting tissues of the tooth which originates from untreated periodontitis. It causes pain, swelling, and gum tenderness. The etiology being blocked periodontal pocket, food impaction, incomplete scaling, fractured tooth, or cases like diabetes. Clinical features of periodontal abscess are pain, pressure, swelling, shiny gums, first discharge, tooth mobility, bad odor, and sometimes fever and malaise. The diagnosis is normally established on the basis of clinical examination, periodontal probing, X-rays, and medical history review. The treatment part consists of drainage through either pocket or incision, debridement using scaling, irrigation with antiseptics like chlorhexidine, antibiotics, follow-up, and definitive therapy like surgery if needed. Here is a case of 40-year-old male patient who complains of pain and recurrent gum swelling with lower right back tooth that is 4-7 since 10 days. Currently, the patient is undergoing root canal treatment with 4-6. You can see the temporary restoration with 4-6. This is occlusal view where you can appreciate the white type of swelling with 4-7. Also, the distal caries with 4-7 is visible. On periodontal probing, it appears shows that there is almost 13 millimeter deep pocket with 4-7. Also, around 10 millimeter pocket with 4-6. So, case appears to be generalized periodontitis case. Mobility was checked using the instruments, and here is a video showing the mobility with 4-7. The X-ray of the IOPA shows not only the bone loss associated with 4-6 and 4-7, but also embracement with 4-6 and distal deep decay with 4-7. The diagnosis is established on the basis of 2000 classification, that is periodontal abscess with 4-7 and endoperioral lesion without root damage in a periodontitis patient. This is a reference chart of 2017 AP classification which shows periodontitis, periodontal abscess as well as endoperioral lesion without root damage. The treatment for 4-7 was drainage, then debridement with scaling root vein, irrigation, antibiotics, follow-up, endo treatment, and periodontal flap surgery. Here is the set of instrument that is being laid out, which includes local anesthesia, set of diagnostic instruments, PP handle blade, periodontal probe, few curettes, that is universal and Gracie curettes, periosteal elevator, normal saline, irrigation syringe, betadine, gauze basis, and a hemostatic agent in the form of hemocol. The hemocol is opened up from the package, a sterilized vial, and once it's opened, the required quantity of hemocol is taken and kept ready for hemostasis after the debridement. The anesthesia is given, the infiltration anesthesia is given on the buccal side. The first method is to try distending the pocket wall using only a periodontal probe and try to establish the drainage while finger pressure is applied from apical area towards the corneal area. Some few cases will give drainage through this, whereas some cases you might have to use a curette and apply it on the inside part of the pocket wall. The idea is to scrape the pocket wall, or basically a curettage is done on the lateral wall of the periodontal pocket. At the same time, this is the curette that is being applied on the inside wall of the periodontal pocket associated with 4-7 to clear out the lining of the periodontal pocket. You also see some amount of drainage as well as the blood oozing from the periodontal pocket. You also try to establish the drainage again from apical to corneal area. While to control the bleeding, you take the help of hemocol, Hollangen sponge. You apply it on the site of the oozing. Keep it for around 4 to 5 minutes. This being a case of mandible, there is also an excess amount of saliva. So a suction being used to control the saliva while the hemocol soaks up the blood. We wait for 4 to 5 minutes. The hemocol soaks up the blood nicely, and around after 4 to 5 minutes, we remove the hemocol. Once that is done, we use the scaling, ultrasonic scaling to clean up the subgingival debridement is done. We can go to the depth of the pocket for this purpose. After the ultrasonic scaling, we take the help of chemical plaque control in the form of chlorhexidine. We take it in a syringe and do the subgingival irrigation using chlorhexidine. This is subgingival irrigation being done. This acts as an adjunct to mechanical cleaning apart from the scaling and root cleaning. So this is the scenario after the mechanical debridement, drainage of the abscess as well as the chemical plaque control. Again, sometimes the patient do report or complain of some amount of oozing. So to control that, you can still use Hemocol and just keep it on top of the gingival area or the gingival surface of the periodontal abscess and let the patient go. You can discharge the patient after application of this. There is no need to remove the Hemocol. This is only to control the secondary oozing from the pocket area. You can apply it only to the area that is affected. And this is the post-operative scenario after around 5 days. Occlusal scenario, you can appreciate the decrease in the swelling. This is the video recording and patient is ready for the completion of the root canal and further treatment of the 4-7. Thank you.